If I asked you to tell me what you think is in this tin, what would you say? Well, based on the fact that it's labeled as Danish butter cookies, you might think that there are cookies inside. Okay, so let me open the lid. It's actually sewing supplies. Let's put the lid back on. Now, a friend walks in. Let's call her Sally. What do you think Sally will say is in the tin? Will she say cookies, or will she say sewing supplies? She'll probably say cookies because she wasn't there when I opened the tin to show that there's actually sewing supplies. In order to answer this question, you're using theory of mind. Theory of mind is the ability to understand mental states, thoughts, feelings, desires, and beliefs, both your own and others. It also encompasses the ability to recognize that others' mental states are different from your own. How does theory of mind develop? Research using the task like the one I just showed you with the cookie tin has suggested that theory of mind develops around the age of 4 or 5, in particular steps. First, children understand wanting, the realization that others have diverse desires. Then, children can understand thinking, the understanding that others have diverse beliefs about the same thing. Then, children understand that seeing leads to knowing. In this stage, children recognize that others have different knowledge access, and if someone hasn't seen something, they'll need extra information to understand. Then children can understand false belief, the ability to understand that others may have beliefs that differ from reality. Lastly, children can understand hidden feelings, the idea that people can hide their emotions and can feel a different emotion from the one they display. Before understanding these concepts, children need to have a number of skills. First, they need to be able to pay attention to things. Specifically, they need to learn how to do joint attention, which is where two individuals are looking at the same thing and paying attention to that same thing. They also need to understand intentionality. This means that if somebody is reaching for something, they understand that that's probably because they want that item. Children also develop the skill of imitation, which allows them to copy what others are doing, to put themselves in another's shoes and see how they may be feeling. Another important skill that's thought to underlie a lot of theory of mind is language. Let's dive a little bit deeper into understanding how language impacts theory of mind. In one study, 3-year-olds were observed across 7 months. Their earlier language abilities predicted their later theory of mind performance. However, their earlier theory of mind performance did not predict later language abilities, suggesting that their language abilities are supporting the development of theory of mind. In considering language as a precursor to theory of mind, we have to ask an important question. Could younger children be failing theory of mind tasks due to the task demands? Are the explicit questions being posed to them too complex for them to understand? To answer this question, researchers have been using implicit tasks that don't use language to examine younger and younger children. Many studies are looking at this using tasks like the violation of expectation paradigm, where they familiarize the baby with a certain situation and then change that to see if they respond in a surprised manner. This would suggest that they were expecting a certain outcome, an outcome they would only predict if they understood theory of mind. This violation of expectation has been measured using anticipatory looking times, and pupil dilation. Other studies look to see if infants will help the experimenter, demonstrating that they understand that the experimenter wants something or doesn't believe the same thing as them. However, there's a lot of debate about whether these experiments are actually demonstrating a theory of mind. Once theory of mind is developed, how is it used in adults? Adults are constantly using theory of mind for social interaction. Theory of mind is important when having conversations with others. Some research suggests that you need to be able to conceptualize what another person knows in order to successfully communicate with them. Theory of mind also plays a role in competition and cooperation. One study found a positive correlation between theory of mind and social cooperation tendency, meaning that people who had a better understanding of others' mental states were more likely to be cooperative. However, there are some limits of adult theory of mind. For example, personal knowledge has some effect on estimations of others' behavior. This study asked adults to report probabilities that the girl would look in different locations in a false belief task. Participants were told that this violin was placed in the blue box. A new friend came, moved the violin, and moved around the containers. Participants were then asked to rate the probability where Vicky would go look for her violin. Participants gave the highest likelihood to the blue container that the violin was placed in originally, but they also predicted a likelihood that Vicky would look in the original location, which now has a different container in it. This probability was significantly higher when participants were told that the violin was moved to that new box, suggesting that their own knowledge was impacting their ability to reason about where Vicky would look. In another study, participants were asked to complete a matching task. Matchers often responded as if the object hidden from the director was being referred to. This occurred even when the matcher knew the director held a false belief about what was in the bag. This indicates that important elements of adults' theory of mind are not fully incorporated into the human comprehension system at all times. Theory of mind varies by individual, and a number of factors can cause a theory of mind impairment in adults. One study looked at 25 forms of childhood trauma, assessed in over 5,000 adults. Theory of mind skills had a strong negative correlation with childhood adversity, such that the more childhood adversity an individual had, the lower they would score on theory of mind tasks. Specifically, parental maltreatment and maladjustment were most strongly related to theory of mind abilities, with many other factors reaching significance. This suggests a strong and lasting impact of environmental factors on theory of mind. Development of theory of mind skills have been notably delayed in individuals with autism. Specific impairments have been found in using their assumptions about agent beliefs to learn about agent intentions. Further, there was a strong correlation between language abilities and theory of mind skills amongst autistic children, suggesting that there might be a link between these two abilities. Theory of mind skills can also be impaired by traumatic brain injury. Traumatic brain injury patients showed moderate to severe theory of mind impairment, particularly in understanding indirect speech and social faux pas. Higher severity of impairment was associated with frontal lobe lesions and right hemisphere damage. Work examining these patients can help experiments understand the neural mechanisms underlying theory of mind abilities. Other studies have also shown relationship between theory of mind and aging. In one study, participants over 60 showed a specific impairment in inferring others' mental states, independent of other executive functions. Now that you understand a little bit about how theory of mind is developed and how it presents in adults, you might be wondering if there are differences between different cultures. One difference that has been found is the sequence in which individuals learn the steps. The steps discussed previously were developed from studies that looked specifically at American children. When examining children in other cultures, we see that these steps may not always develop in the same order. Understanding differences in opinions and beliefs develops later in collectivistic cultures such as China. The idea that seeing leads to knowing develops later in children from Iran. These findings suggest that culture does have an impact on how quickly children learn aspects of theory of mind. However, there was no difference in overall rates of theory of mind mastery. Other cultural differences found can actually be explained by similarities. One study looked at a sample of children from Hong Kong and another sample of children from the UK. Both samples showed correlations between parental mind-mindedness and theory of mind. Parental mind-mindedness is the tendency for parents to recognize that their children have their own thoughts, beliefs, and ideas. It was also noted that parents from Hong Kong were less likely to exhibit mind-mindedness than parents from the UK. So, while there was differences discovered between the two cultures, mind-mindedness accounted for these cultural differences. This suggests that cultural differences found in theory of mind skills may be less due to overall cultural differences and more due to specific variables that are similar across cultures. Another study examined executive functioning of Chinese and American preschoolers and how that related to their theory of mind skills. Chinese preschoolers outperformed the Americans on executive functioning measures, but there was no difference in the theory of mind skills. However, for both Chinese preschoolers and American preschoolers, executive functioning correlated with theory of mind skills, suggesting a similar underlying variable in how theory of mind is impacted. Let's review what we learned. We discussed that theory of mind is the understanding of mental states. We discussed how theory of mind develops in terms of the steps that children often follow, the precursory skills needed to understand theory of mind, and the fact that the task demands of many tasks used to measure theory of mind may not in fact be allowing us to see the understanding that younger children may be reflecting. We also talked about how theory of mind is used, the limitations and impairments that could happen in adulthood. And finally, we discussed cultural differences and similarities. Thanks so much for learning with me today. You deserve a cookie. Oh wait,